Assalamualaikum and good morning. We are from Group 14 where we discuss about case study 2 about artificial vascular graft. Cardiovascular disease or CVD is a vascular disease including coronary and cerebral artery disease. Artificial vascular graft is used to replace entire section of large arteries or to patch damaged or diseased arterial segment. It's an intracorporeal device that can implant in the body, so they need to be made from the material that can be used long time and follow some key requirements such as blood compatibility, non-toxicity, durability, and non-release of foreign substance. This artificial device should mimic the function of the organ replacement organ without disturbing its environment. Before using it, it has to undergo in vivo and vitro tests to ensure the effectiveness of the material.
The implantation of a synthetic material like polymer-based vascular graft in the body triggered the immune system response. The acute inflammatory response involved the release of pro-inflammatory cytokine, recruiting immune cells like neutrophils and macrophages to the site. The chronic inflammatory response involved the activation of macrophages and fibroblasts who struggle to fully degrade the polymer material. This leads to the release of inflammatory signal, causing the formation of a thick collagen shell around the graft. The presence of a blood clot indicates that the graft did not provide an ideal surface for endothelial cells addition and growth, triggering and coagulation
To
together.
overcome the problem, I suggest to implant another type of synthetic vascular graft which is more biocompatible to reduce immunological reactions and decrease the risk of thrombosis. For example, Tecon graft, also known as polyester graft, as a woven form of Tecon graft, have small pores and smooth surface. This property can decrease the composition of foreign body reaction, which is only composed of a layer of macrophage 1 to 2 cells in thickness. The surface property also can decrease the risk of thrombus. Besides, Teflon graft, also known as PTFE grafts, is suitable as a synthetic vascular graft because of its very low surface tension and friction coefficient. The second suggestion for me is to transplant biological graft as this results better in hemostasis and it can prevent foreign body reaction. For instance, autograft is transplanted from parts of a patient's body to another. Allograft can also be used as the transplanted vascular graft tissue derived from a donor of the same species as the recipient. Xenograft, where it is a surgical graft of vascular tissue derived from an individual to be transplanted into another species. The third suggestion is to modify the implant surface by using antithrombotic drugs. Antithrombotic agents such as anticoagulants and antiplatelets, which are immobilized on the product surface, can be used to eliminate or reduce the risk of blood clots. Anticoagulants such as heparin will activate antithrombin that inhibit thrombin and factor XA, which prevent clotting. Antiplatelets such as aspirin thus help in thinning the blood and preventing development of clots.
Synthetic vascular grafts are made from polytetrafluorourethane, dichrome, and polyurethane. These implants are used to replace weakened blood vessels due to disease such as aneurysm, which is a blood field dilation that are caused by weakened blood vessels and disease, and atherosclerosis, which plaque builds up in your arteries, but this is usually treated by medicine and lifestyle changes. Synthetic vascular graft is in contact with blood and a permanent medical implant, which means that this implant duration in the body are more than 30 days. By referring to the table of biological evaluation tests, this is all the tests that needs to be done except for two, which is the reproductive developmental toxicity and degradation. Synthetic vascular grafts are not related to the reproductive system, and since it is made out of synthetic, it is non-biodegradable.
In conclusion, I would like to propose a material. It is a thin expanded polytetrafluoroethylene coated with anti-CD133 antibody functionalized heparin or collagen multilayer. It is suitable for medium or large diameter blood vessels grafts such as 6 mm and above. This material has the chemical properties of electronegative, good stabilities, non-degradable polymers, and do not undergo biological deteriorations in vivo, and thus minimizes their reaction with blood components. Besides that, in morphological properties, it is thin, highly uniform with a well-defined pore size to allow the passage of fluids and nutrients, and the knot and fibril architectures provide mechanical strength and stabilities to the material. while the fibrous contributes to the porous structure. Lastly, for the mechanical properties, it is inert material and thus decrease the possibility of thrombosis and restenosis. And it can reduce blood loss, prevent graft infections, highly durable material that can withstand the pressure of blood flow, and it can be shaped to fit the specific contours of patient blood vessels.
All material must undergo in vivo and in vitro testing according to the ISO 10993 to ensure that the material are biocompatibility before using. The main obstacle in building biotechnology are biocompatibility, mechanical strength, and long-term patency. The engineering of vascular graft from the recipients on tissue has been introduced that have better biocompatibility and performance than synthetic blood vessel, but has the problem of the poor mechanical strength. Maybe it can be developed further with the help of more advanced technology in the future. That's all from us. Thank you.